morning. It is 23 minutes after 9 o'clock, and joining us in studio this morning, we shifted on you. We're going to shift a little bit, so we'll play that other one later for you. But we have Dr. Sarah Usher and Dr. Keon Ahghar from Carabelli Dental back with us this morning.
Good morning.
Good morning, guys. How you doing today?
Good, really good. I mean, I stopped floating down my street at home, with all the rain, so I'm good now. I'm all dried up.
Well, just when we thought we were maybe through it all, then we got reminded yesterday that there was some more coming, and
oh man,
and that was mostly in the hail variety. You were like, man, we didn't get much hail that last time. A lot of rain. It's like, well, but wait, here's more.
I think it's funny in New Mexico. We're always sitting there. We're like, oh, we need rain, but it's like, okay, not all at once. Like,
right?
Let's slow it down.
Yeah, exactly. Yeah, it's like, there's always the joke about New Mexico, and you're like, man, you guys, it's like, we get about 5 inches of rain a year, and they're like, wow, that's crazy. That's not much. You should be here the day it comes.
Yeah, that's the one day. It's wild out there, man. There's a lot of damage around town. So yeah.
Well, good news if you're dealing with that stuff and you're tired of that, there's a lot less hassle taking care of your teeth. There's a lot less hassle, and be honest, no one's gonna just randomly throw hail at you. So very good.
Yeah.
But if a piece of hail did chip a tooth, you know who to call.
This is true.
Yeah.
Has that ever happened? You ever had a storm-related dental injury?
We're waiting eagerly on the emergency line this weekend to kind of, see if we would get something hot, and nothing came through.
A tree branch was flowing through and whacked me right in the choppers.
I was looking up to see if it was really hail, and then...
Here's a tip. Don't leave your mouth wide open in a storm. Something will fly right in there.
Yeah. Don't look at the sun and don't look at hail as it's coming down. 2 rules.
But for folks who don't know, of course, these two, they're at Carabelli Dental. They do an amazing job, them and their entire staff, of making really, at the end of the day, I mean, providing great service. That's job one. But part of your job in the dental industry nowadays is kind of dispelling like dental of yore. You know what I mean?
Right.
It's kind of... you get people, especially you get older folks that they don't go regularly. They're kind of like, I'm not going to Dr. Hooks and all that stuff. And, there's that mindset. You know,
it's the memories. It's like everything that people have been through. I've literally heard like the whole story about like, the foot on my chest, let me pull out that tooth type of thing, So, things like that, you remember and you don't want to go back when something's wrong. So that's typically what we hear is like, nothing's hurting me. I hadn't come back. And now, oh my gosh, like I have this bad pain. What are we going to do? Right.
Yeah.
So,
and just so your listeners know, I'm not flexible enough to put my foot on your chest while pulling the tooth. I can't do it.
He was a 20.
I really tried to imagine how to make that happen. And yeah.
Well, it's all about working smarter. As you get older, you get better leverage points.
Exactly. Exactly. Yeah. We have tools now to help us with things like that.
I think back in the old ages, they used rocks and chisels to, get teeth out or something. They must have been doing something wrong.
Yeah. Although I remember when I was getting one of my wisdom teeth, it was one of the bottom ones because I had to get knocked out for that one.
Sure.
And I woke up like in the middle, and they were kind of, and I was kind of like, hey, I don't think I got enough. And next thing I felt this palm on my forehead, push me back, go back to sleep. Boom. Yeah. But I don't remember pain, but I do remember like, I don't think you guys got enough.
Was that in the military?
No, that was, it was... it wasn't Dr. Carey, who's there before you guys, because I had to go to one of the orthodontists, and it was the regular gentleman was actually in the guard or something.
Right.
So he was deployed, so they brought in another gentleman that was retired.
Oh, wow.
And he was good, but he was about 157.
Sure.
And so,
he was seasoned.
Yeah. And, he did a good job, everything, but, I remember waking up in the middle. That was years ago.
Well, at least you didn't get it done in the military, because I don't know that they would have...
No.
They probably wouldn't have knocked you out or numbed you.
You've seen some of the military work in my mouth.
It's good.
Yeah, they did some fill-ins back there. Yeah. I think they used like gold or something. It's something they haven't used in 100 years.
Gold is actually the best thing for your mouth. That's awesome.
It's probably not gold, but it's the military.
We'll
the
pretend
cheapest
They
guy.
just kind of painted it a little yellow.
We'll pretend it's gold.
Gold plated.
Yeah.
It's gold plated. It's cubic.
Were you in the Navy? They had to do like blue and gold.
A couple of
Air Force.
Air Force.
Okay.
So you had to get it done between golfing sessions.
It turned green after a while.
Yeah.
There.
We're not for what color it is anymore, but you know.
It's like it's kind of like depending on how the light hits it. You know, it's a green hue at one day, and kind of a blue.
It's like what color are we trying to make our eyes like pop that day, right? You know, like let's wear really green. Let's have a green feeling today. So my eyes will look green. You know?
Actually, it looks like one of those old Civil War cannon colors. I don't know, battlefields, but about 10 years, it's that color.
It's actually
maybe we probably should revisit this tooth and see what we need to do with this. This seems not right.
It's actually a mood ring feeling. Ooh.
That's right. It is. It's kind of like, stay away. That filling's a hot red. Stay away.
He's angry today.
But
maybe that's a good idea. But we should put some fillings in people's mouths that it's kind of instead of a mood ring, it's like a floss filling.
Oh, okay.
Depending on how often you floss, it changes colors. And so
that's not a bad idea.
When it's bright red, you haven't flossed in 6 months.
It's kind of like the kids' toothpaste stuff. Those pills. I don't know how they do it nowadays. When I was a kid, it was like a red tablet.
Yes.
And then it lit up your teeth red for every place you didn't brush.
Yeah, exactly.
Of course, mine looked like I just chewed a piece of cherry pie when I got done.
You brushing? Yes, every day, 3 times a day. Okay.
I brush with cherry pie.
That sounds like me, a la mode.
Okay, I got to ask you guys a question because my wife thinks this is a savage move, but I do this sometimes when I'm in a rush. Generally, what I do, I brush my teeth and everything, and then I got mouthwash, and I do. But if I'm running late or lazy, sometimes I just pour a swig of mouthwash in my mouth and toothbrush with that at the same time.
Without toothpaste?
Without toothpaste. So in essence, I'm brushing with the mouthwash.
Better to brush this with the toothpaste.
I'm sure it is, but in a pinch,
drop the mouthwash.
Is that a good, acceptable,
The only thing that, when you tell me that, it's what kind of mouthwash are you using? Because you know what, if it's alcohol based or...
No, it's the Total. It was a Crest or Colgate Total. It's blue. It's the blue flavor.
Oh, the blue one.
I think it's Complete. The Crest Complete.
Okay.
Yeah, it's that one. It's alcohol free.
That's okay. So that's probably good then.
Okay.
Because I was kind of worried about
when she says good, she's just being nice to you. It's totally not acceptable, Mike. And to the listeners, that's not okay. But
it's better than nothing.
It's
right?
it's good for our business.
Okay. But I don't do it every day. But once or twice a week, I'm like, all right, I'm running late.
Yeah,
this is going to be the move today.
Yeah. I gotta go talk to someone in 5 minutes, and I don't want to be stink breath. Yeah, exactly. I think it's totally cool.
Okay.
Yeah.
I just was making sure it was alcohol free. You weren't damaging your teeth scrubbing it.
I'm a bit of a wuss. I don't like the alcohol. It's too stingy in my mouth. I don't like it.
Okay, yeah, sure.
Then we're on the same page.
Yeah, people with the Listerine stuff, and I'm no.
Yeah.
I was like, are you a masochist? Why do you like that?
Why do you sell
I think people
that?
do it. So Listerine. This is a real quick history on Listerine. It was actually developed initially not by dentists or scientists or anybody in the medical profession. It was a marketing company.
Was it like a snake oil salesman type?
No,
deal?
yeah, it was one of the. It's actually taught in a lot of marketing schools, business schools. There's a whole chapter of books dedicated to this guy.
Okay,
he's one of the most successful. He was a kind of a origin guy. He came up with this way to market because he associated the feel of the burn. They did all these advertisements. I think it was in the 50s or sometime in the mid, at least 70 years ago.
Sure.
They did all these advertisements where they were marketing people this
the burn
and
means it's
that
working.
burn. And they tried to
fresh.
he worked really hard to associate that burn and that sound, right, with feeling clean, right? And literally, they didn't put anything in there that was really good for. You could just rinse with salt water. Would have been fine.
As beneficial.
Or baking soda water. Yeah. Honestly, just as beneficial, if not more. But that burn they put in there with the menthol and the alcohol gave people that burn, and they literally marketed it. And they went from I think maybe less than 5% of the population used mouthwash to something 50-60% of the people. It was one of them within 5 years.
See?
5 to 10 years. It was this phenomenal thing they did, and it was amazing. Now, from a dentist standpoint, it's okay, they didn't really do anybody any good because all they did was just cover up bad breath.
Sure.
And
they're not actually killing germs.
Right. It really didn't do much. I mean, you're better off just taking a shot of tequila and swish it around your mouth.
And then the rest of your food probably doesn't taste as good anymore because you're burning taste buds.
But it's amazing. It's what they really did associate.
But you could do the and feel real good about yourself.
That's right.
Yeah.
You won't,
and they literally, people would do it and then go, to check it, and you feel that burn. You're like, oh yeah,
It's
I'm
working.
clean.
I
working.
did it. Yes.
So it's kind of amazing. It's like a feat of marketing. It was, they teach it, like I said, in schools and stuff now. It's like
So if you're of the mindset that the burn means it's working,
yep.
you don't need to dump that.
You're wrong.
Yeah.
Go pick the non-burn free, alcohol free.
It works just as good.
Good types of.
The way I look at
mouthwashes.
it is like the burn one is, they put alcohol in it, and it's like what 6, 7, it's under 10% alcohol.
Okay.
But now everybody's very familiar with hand sanitizer, right? Everybody in America has
Sure.
used hand sanitizer at least once in their
yeah.
life at this point.
Yeah, exactly.
And that stuff's like 60, 70, 80%, right? And it kills the germs.
Mm-hmm.
So if you're rinsing with 10% in your mouth, and then it's getting diluted even further with your saliva, it's not doing anything besides that feeling of the burn.
Annoying your mouth.
Right. No, yeah. Exactly.
Agitating your mouth.
It does.
Yeah.
Why do
And
I have
so,
all this red spots in my mouth,
Yeah.
doctor? What have you been rinsing my head?
It's like, it's kind of the same
Jim
guy
Beam.
with the soup.
Yeah.
It's like blow on the soup first. Quit just shoveling it in, and it won't happen.
Exactly.
At some point, you need to. You keep doing the same thing over and over again, expect different results. Whose fault is that?
right.
Oh my god.
So I mean,
So let me ask this then. I mean,
Yeah.
because I mean, I'm sure brushing and obviously flossing and using mouthwash is beneficial in the combination. But if you're doing brushing and flossing and no mouthwashing, is that a detriment like the mouthwash people say it is, or is that all marketing genius again saying, it's overkill?
So
you're
I
fine?
like to tell people actually not to rinse, and so we really teach people how to brush. Okay, so so if you go buy like toothpaste off of the counter, wherever you go buy toothpaste, typically it has some form of fluoride in it, right?
Generally, yeah.
And the fluoride is what kind of helps strengthen the teeth, right? And kind of keeps our bacterial levels low, maybe, or fights against the bacteria or whatever, and makes our teeth stronger. So think about this. So we all learn to brush our teeth, right? And then we all learn to spit it all out into the sink and then rinse with water, right? Rinse it all out. Well, what are we doing with all the toothpaste that should be staying on our teeth? We're rinsing it down into the drain,
This
right?
is true.
like imagine
So-
you put lotion on your skin and then
you go
2
rinse it
minutes
off.
later, assuming you even brush for 2 minutes,
Right.
2 minutes later, you just wash all the lotion off. How much effect does that lotion have?
Gotcha. You're right. Yeah.
So one of the things we like to say is don't rinse after you brush, especially if you're using like some type of toothpaste that has fluoride in it, right? And we have a couple at the office that we really recommend, especially in some certain situations. But so that's the thing is don't rinse. So if you're going to use mouthwash or anything like that, we like to say save it for another time in the day. Like maybe if you can't brush right after lunch or something,
Sure.
and you got meetings or
Freshen up
whatever.
before a meeting or
exactly,
something, yeah.
exactly.
Okay.
So we like to say don't rinse your mouth after you brush. Spit it all out and kind of whatever stays on your teeth, let it work on your teeth. So that's kind of interesting to answer your question.
But I will also say, and for most people, that's what we recommend. But everybody's different, right? So everybody has different concerns. Some people have gum disease. Some people have a lot of cavities.
So
some people
your
are kind of like
routine's
in
gonna be a little
between.
different, yeah.
Some people have a lot of dental work, or they have like a lot of our patients. They have implants, or they have dentures. It's every mouth is a little different.
Sure.
So there's not like one care routine that's perfect for everybody.
And
right?
sure, dental health, there is hereditary issues there. I mean, if you've got a family history of just teeth issues, odds are pretty good you're probably going to, that's going to pass on to you. So you're going to be more apt to need root canals or braces or things because your family just has a history of that. And where other families come out and they look like movie stars. It's just,
Exactly.
it's just the look of the draw,
Exactly.
But
Exactly.
it's also interesting. It's a lot of it, not just genetics too. It's a lot of, if you really think about it, cavities and gum disease are really bacteria-driven diseases.
Sure.
Right? So that while the body is still doing something, the body is still kind of involved in it. And this is maybe gross and maybe no one wants to listen to this, but they are bacteria-driven infections.
Sure.
To a point, right? So bacteria they build acid, and the acid eats the teeth. Or when it comes to gum disease, they basically colonize underneath plaque and bacteria and basically like mineral buildup around your teeth.
Sure.
And cause an infection. Your body reacts to it and you get gum disease.
Sure.
But both of those are caused by bacteria. And just how do you get that bacteria?
Just through life.
But where?
I didn't know we were taking a test this morning.
But really, where do you get it from? So a lot of it is passed down from who? When I have my son at home, and I'm like checking the temperature of the spoon or the soup before I feed it to him,
So you
what
get
do
from
I do?
the
I put it in
kids.
my mouth. Or the bottle. I'm going to clean the bottle.
So it's the parents giving the bacteria to the
Families
kids.
kinda-
It's
Inoculation.
Called vertical transmission. Basically, you're passing from parent to child.
Or maybe
right?
it's not parent. Maybe it's grandma or
Boyfriend.
grandpa
Gotcha.
who
Okay.
has like gum disease.
Yeah.
So in essence, by inadvertently, you're swapping DNA there and laying the groundwork for
It's
some
like-
of that
You're
stuff.
swapping bacteria. Just, I mean, it's
It's like French kissing.
Gotcha.
It's no different than
Maybe you should do this speech in high school.
Yeah,
Like,
no,
when they're all
it's gross.
dating.
No.
And then, dating
You
numbers
want,
drop.
You want
Yeah.
Jimmy's bacteria, gum disease bacteria in your mouth, Sally? Okay, think twice, girl. Think twice.
Yeah.
But you almost always see if like a wife has gum disease, you almost always see the partner, and a lot of times the children will have some level of that, right? And again, it's if you take the bacteria and send it to a lab and they do fancy stuff to it, and they put the genetics through, right?
Yeah.
It's almost the exact same strains because bacteria are just like dogs, right?
So this is like side note, like parents, if you want to know if your kid has the bacteria of their boyfriend or girlfriend, like we can do that for you, right? Like we can swab their mouth.
all right.
And send it
We
off.
know their doctor could
We
do
can
that.
send
Yeah,
it off to pathology
Man.
for you, and we can really get down to business.
Y'all might get on Jerry Springer
Yes.
or
Yeah,
something.
right.
Exactly. Exactly.
And the results are in. Maury Povich calls y'all out.
We got Carabelli Dental on the line, and we just gonna get to see what that swab test looked like for
You are not the
Sarah.
father.
You never know, right?
You never know.
It's an opportunity.
So it is passed down. I mean, to a point. I mean,
Sure.
people get other stuff passed down too, genetic
Sure.
stuff, but that plays a part, which is kind of gross. But
and
you
it-
think about it, it's true. You
and it
swap
make-
and spit.
Yeah, and it makes sense too because and really in anything when we talk about getting into the body and bacteria, I mean, it comes in the same way it comes in everywhere else. It comes in through orifices and holes and where it's
Exactly.
most likely to it. And unfortunately,
What did you touch?
your mouth is the biggest input in your body for the most part.
Right.
You know, I mean, breathing to food to water to everything else. It all starts there sometimes.
Yeah.
It's just
Yeah.
kinda-
But at the same time, if you know that, and say you have a mother that has a lot of gum or cavities, right, and she's pregnant, well, try to get it all taken care of and try to really get her mouth really clean before the baby comes, or just understand that and try to really be cognizant of what you're doing. You know, maybe instead of like taking that pacifier off and licking it when it falls on the ground, just rinse underwater. Little things like that can kind of not inoculate those kids with those bad bacteria. And you can stop. And there's been lots of studies that stop that. But that's kind of.
I can see dads and grandpas and aunts doing that, but I don't see a mom.
Sure.
I mean, this kid's breastfeeding, everything.
Yeah.
You're like, what could I possibly do to contaminate this kid at this point that I'm not? We can't get much more intimate.
But
here,
as
you know what I mean?
as grandparents,
I
you
can
also-
appreciate that.
Yeah.
But I have one child, so I'm like pretty nitpicky about everything, right?
Gotcha.
There's some families that have like 6 kids. I'm pretty sure that mom's throwing that pacifier in her mouth to clean it off to put it back in that kid's mouth. But
there's
I'm
the
just
difference.
saying.
Kid
I'm just
one,
saying.
it's to the
Or
point.
taking it out of one kid's
Exactly.
mouth,
Kid
popping
two,
it
it's like
in another
rolls
kid's
in the
mouth.
dirt. It's like pants are fine.
Exactly.
Here you go.
I mean, sometimes you just like it's like how do I do the best I can in the situation I'm in? Okay, let's do this. Like
Right.
you know
Sure,
what I'm
right.
saying? So
Well, and I always wonder too if the other argument is you got to expose kids to some of that
Sure,
to
absolutely.
build up the immune
Immune
systems
system.
and things like that. So you got to find that balance.
But that's where the dirt's from. That's the dirt's
that's
from.
Yeah, so you rub the dirt on?
eating the dirt. That's
Yeah.
how that comes.
Dirt and
So-
rocks. That's what it's good for. Yeah.
Although you eat enough dirt and rocks, you'll be coming to see the dentist before you know it. Yeah.
Well, just don't grind on
Either
it.
way you look at it, we could help.
That's
Okay?
right.
Either way you look at it.
Do it with the baby teeth because they knock those out. They're other ones that come in.
They go away. It's fine. They fall out
Get a
eventually.
new one. It's fine.
But we do want to remind folks, don't ignore your dental. I mean, I understand, the stigma of dentist visits and all that. And I'm telling you, it's way different. There's a whole mindset in dental work in nowadays for kids, for adults, for everybody, because of, let's face it, all the things we're talking about here, the jokes, the Norman Rockwell paintings of the kid in the chair screaming, that's the image we have of dental work. And, and it's really not that way. Technology, the advancements, if you're really uncomfortable and squeamish and not just, I can't handle this, trust me, they've got techniques, they've got different methods. They can, the IV sedation surgeries, if it's that bad, where you're so nervous that they got to knock you out to clean your teeth, so be it. We'll have to do that.
Exactly.
But obviously that's not route one. If you're okay with it, we're not going to knock you out and ruin your day just to clean your teeth. But if it's that big of a problem.
Yeah.
We'll take care of what we need to do to make sure that you're happy and healthy.
Exactly.
And it's one of those things that like a lot of people also, I think we encounter a lot of people who have been sitting on dental work. They know they have an issue. They know they can't smile. They've been living with it for so long. And they're just embarrassed, or they just and that's the thing about our office is there's no judgment. Our staff is wonderful, as bad as you think it is. Trust me, we've seen worse. But that's not the whole point. The whole reason I say that is because we've helped people with worse, and so what people come in with all the time, thinking that it's going to be really bad, and it's routine for us. I mean. While we do a lot of the stuff that normal dentists do, we do the fillings and the cleanings and all that stuff. Majority of what we do is kind of the bigger stuff that other people don't do.
Gotcha.
The big makeovers, the big implants, redoing, do all the stuff you sometimes see
restoring
on TV.
A smile again.
Right, restoring a smile that has pretty much just fallen apart. You know? And life happens. I mean, people, and it just kind of, and sometimes, especially with dental work, it seems like it just, you get. I saw someone recently. There was they had a couple things going on, and then they got kicked in the face by their kid. Yeah, or they fell in the concrete, and it's just it just started cycling, right?
Sure.
And then they start going in, and it's like every time they went in, something had to get pulled, or this and that, and this and that, and life just happens,
Absolutely.
and we understand that, and our goal is not to sit there and dwell on the past. It's like, how do we move forward and get you back to where you can go to your kid's birthday party and smile? You can smile in pictures again. You can, go do whatever you want to do. Go eat that steak dinner.
Yeah, and it's one of those things we'll suffer through just so we don't have to let people know or whatever.
Right.
And the part is you don't realize how mentally you're torturing yourself with that stuff because the moment you get it fixed and you bite into the corn of cob or the steak or smile and it looks and you're like, I don't have to hide or shun or chew on my left side or do any of the stuff the things I've been overcompensating with to try to meet this inconvenience I've been dealing with for years. Get it done. And it's not that painful. It's certainly nothing to be embarrassed about.
Absolutely.
The pain level, like I said, if it's more intense stuff, they knock you out for, if it's, and trust me, I was talking about this last hour with military stuff. I don't like shots and all that, but I've kind of gotten over it. But I've been shot in the mouth with the Novocaine needles. It's not that bad.
You make it seem like you took like a 9 mil to the mouth.
Well, but I mean,
I've been shot before.
People get so you see a guy. All right, this will only take a second. You got this needle coming at you. Like, what the heck are you doing? And I get it. You're like, okay, that is scary. Some guy's pointing a needle and going in my mouth.
Absolutely.
That's not normal.
Exactly.
You know what I mean? So but once that happens, you're like, oh, there was a little pinch. That was it. Because you're thinking, where are you going to put that? That's all bone in there. Like, I'm going to hurt. And it works. You know what I mean? Because I'm thinking, though, it's like, you need a good fatty spot to put that in. Or, there's all bone in there.
I got no fatty spot.
Yeah, there's no fatty in there. A lot of other places, not there. And so, but it really isn't, you overthink these things. And we work it up in our heads. And we try to come up with reasons not to do it. And we end up talking ourselves out of this stuff more often than not.
You bring up a good point because there's so many times when people have come in like, I haven't been to the dentist in 5 years or whatever, and it's like, I think there's a lot going on. You look and you're checking things out. And it's like, actually, there's not.
Yeah,
like, this is really cool. Like, you need a good cleaning. Like, you have like this tiny little space here, like a little cavity here, maybe. But it's like, you're cool. So I think that's the other part of it too. Is sometimes we, like you said, work ourselves up so much to think, I got all these problems, I'm not going to go in. When really, it's not as big of a deal as maybe we think it is, or the patient might think it is. So that's important too, because if you can get on a good routine, a good, visit the dentist routine, then we are kind of being proactive about things, which
Absolutely.
is good.
I'm going to throw one more argument on why you should do this before we wrap up here, and the other is the overall health side of it. And science has made light years in advancements when it comes to relationships between dental work and overall health and other aspects. I know we've talked, the heart connections and all that, but we don't realize it was that what we were talking about earlier. That orifice is one of the main ways things get into your body and come out of your body and do everything else. There's a lot going on there, and a lot of your work in your mouth also relates to other parts of your body. It's all connected and everything else. So
Absolutely.
A healthy mouth can lead to other healthy parts of your body too.
Absolutely.
It all leads to that. It's all connected.
Yep.
And combining that, building on what you said though, it's not only that, it's not only has has medicine kind of started incorporating dentistry more, but dentistry, at least in our practice, has really started incorporating more medicine. You know, like Dr. Usher does a lot of sleep apnea stuff. She's really involved in not only just
teeth related,
not only just helping guiding people to get that treated, because to be honest, that's standard of care. As far, according to the American Dental Association, that is what every dentist should be doing. And yet we still get people coming all the time who are like, "Oh, why are you asking me these questions? It's weird. Why are you asking about my sleep?" But that's we're trying to stay not only just on the cutting edge, but far within, what the rest of the world should be doing.
Sure.
But not only that, I mean, we treat a lot of patients who are undergoing complicated medical procedures, a lot of our patients are coming from MD Anderson or Chimera or, cardiologists or whatever, they're coming from having a lot of medical stuff going on that we're trying to get them healthy and working with their doctors to get them healthy.
Sure.
And then we're incorporating, the IV sedation where we're putting people to sleep, where they can just kind of snooze right through their appointment. They're nice and comfortable. And then also, we're one of the few offices in New Mexico that does PRF, which is platelet-rich fibrin. You come in, you get a tooth pulled, and if we end up drawing your blood and, spinning it down, we can do really amazing stuff where you almost need no pain meds afterwards. You have almost no pain. And we're one of the pioneers in New Mexico doing that. I am not really aware of anybody else doing it. It's one of those things. It's in big.
And people are familiar with PRF when it comes to spinal, injections,
facial stuff,
joint injections. So I've been in conversations with many patients who are like, wow, PRF in the dentist, and they know what this is because of their spinal injury and treatment. So it's kind of cool because now they're putting two and two together. Like, wow, when that gets injected into my spine, I feel so much better, or my knee, or my ankle, or my hand. So when they're like making these connections, like, wow, that makes sense. Like if you're going to do something in my mouth, that treatment's going to help me. So that's what's cool.
Yeah. It's all connected.
Exactly.
And it's using the body and using science and medicine to just have better results and make it all just easier.
Absolutely.
Making it less dentist-y and more just patient-oriented.
Absolutely. Yeah, it really is. And I know from personal experience, anytime you go to visit Carabelli Dental, I say it's a fun atmosphere. It's a dentist office.
It's still a dentist office, but we try to make it
party
fun,
hats and bouncy houses, but
I need to get a bouncy house.
But it's a family, just fun environment. It's safe. You don't get the feeling of all right, I'm about to go and be sentenced to something here. It's you're going in. It's you're talking. Your assistants, the dental hygienists, everything are involved with your health, and you kind of work with the same ones. So when you come every 6 months for your cleanings, they're familiar with your history, your track record, the whole. It really is a great experience, and if you're having apprehension about any of these things, whether it's even financially to just I don't want someone in my mouth putting metal things in it, please come. If you have those issues, talk with these two, talk with the assistants about it, and say, look, it's been a while. I really am nervous and uncomfortable. Can you give me that treatment? And they'll be sure to. You guys will make sure they'll do. And you guys, regardless of if people say I'm nervous or not, you're very good about hey, this is what's going on right now, and just keeping people informed about the process of what's going on, whether it's just a cleaning or they're doing a root canal or something else in there.
It's good to. I'm happy to hear that you've had such a good experience. It means a lot to us when we. It comes full circle and we can hear the experience people have had because we try really hard, as you mentioned, to make that experience a good one. Yeah. So we appreciate that that you can say that for us, about the office and about our team.
It's one of those things that I'm like everyone else. No one wants to have people doing stuff to your mouth. I'm not like I can't wait, yippee skippy. I'm not, I'm not like that. But I don't look at like dental appointment, kiss of death, dreading it 2 weeks until dinner. I'm not doing that either. I'm like, it's dental day. Okay, I got to go do that. No big deal.
Get it done.
No big deal.
And I think a lot of it is also, not only are we not trying to, we're trying to help patients who are, because why wouldn't you be nervous? Because who's not nervous before surgery or any type of procedure?
Absolutely.
It's human
nature.
Anything
it's invasive to you, you're uncomfortable
absolutely.
about it. I don't care what level it is.
Absolutely.
Yeah.
But also trying to create an environment where patients they don't need to feel that way. So maybe they don't come in nervous. Well, how do we make sure they continue to stay that way? And that's really important too.
Yeah, trust me, I'm one of those people that like when just people come to talk to you and they get like right here, I get, those people that don't know personal space.
Sure, yeah.
I'm uncomfortable with that. And so trust me, the dentist thing, I get you. I don't want that either. I have a couple people do it. How you doing? You're like, right here. I'm like, are you blind? I'm right here. Back up.
I was good until that 2.5 seconds ago.
Noses aren't supposed to touch when you're talking.
No Eskimo kisses.
Even in COVID, they're doing this. But anyway, if anybody has any questions about anything or new patient, or you're like, oh yeah, I got to schedule my appointment. I heard him on the radio. I'm due for a cleaning. I need to get that done. What's the best way to do that right now?
Yeah, so our office is right on Main Street over by the convention center.
Right next to the convention center?
Right across from Ford dealership and next to Sonic. So
yes.
You can grab a milkshake on the way out. But,
on the way out. Don't.
On the way in. Don't let me see you with
they don't want to be picking out burger out of your mouth.
And, there's the ride in Roswell. And then
unless you bring me tater tots, then I'm cool.
Yeah, in that case.
Yeah,
we're all good.
You bring a Route 44 and a snack, you're good to go.
Then I'll clean it out. Don't worry.
And our office phone number is 575-622-4455. 622-4455.
Yes, please get that scheduled. What's the website too? If they can, is it Carabelli Dental?
CarabelliDental.com. Yeah, and we have a lot of information on there too. It's a good place to start too if you're kind of just trying to figure out if it's the right place for you to start your like dental stuff.
But, learn about services and everything. If you want to learn more about sleep apnea and you're thinking I have that, but I don't want the big CPAP machine and all that mess. Schedule an appointment with Dr. Sarah Usher here. She can sit down and see if you're a good candidate for that.
Exactly. Exactly. We can work with your sleep physicians and make it happen.
My wife's been using hers for a couple years now, and she loves it and that it works. I mean, she'd rather not have to do anything.
Absolutely. But a better quality of life. You're sleeping well. She's sleeping well. She's happy throughout the day, so it makes a difference.
You just turn on the CPAP next to you just to for old time's sake.
Actually, be honest,
white noise.
It's one of those things where at some point now I'm like, because before, like on weekends, I go to bed later and she does.
Sure.
She's like 9:30, ready to pass out.
Done.
I'm like 11, 12, and depending on what's good on TV. But now when I go to bed like that, I'm like, is she asleep? Because normally I could tell. I'd be like in the other room. I hear the saw and wood going on. Now it's just like a little purr sometimes. And you're like, she's asleep. I can't tell. I better not make loud noises. I don't know.
Don't disturb the slumber.
That's right. Very good. Is there anything we missed? Anything we wanted to get?
I don't think so. Yeah, I appreciate your time today. Thanks for hanging out with us.
Yeah, thanks for coming in, and we'll see you next time here.
Yes,
and who knows? Maybe if you got patients that want to come and share stories and stuff too, I'd love to have.
That would be phenomenal.
I know we got Sean, but people are tired of talking to Sean.
Yeah, tired of hearing that guy.
That's right. Sean's got dates now because of these two. Thanks to.
Oh, I didn't know that.
I'm gonna have to get the 411 on this.
Yeah, and then pay attention to our Sunnies because we keep they're doing the carry. I want a suplex Sunny situation, and then part of me wants to collect like a whole set, and then I'm going to find a guy and have KC in the Sunshine Band.
I love it.
Well, thank you guys.
Always a pleasure, Mike.
We'll see
Always
you next time.
Yeah.
Thanks.
All right, it is 9.